Perfect. It is my presentation. Thanks to give the opportunity to talk in Valencia today. The presentation is about a study on that gives the correlation between the green area in Italy and Spain and the spread of the COVID-19. It is an observational multi-country retrospective study that uses the technique of the real-world evidence to estimate this correlation between the green areas and the epidemic COVID-19 spread. I use like an outcome not only the spread but only the hospitalization and the deaths. So thanks also to my co-authors that helps me to develop this project. Basically, Professor Alessandro Miani, Prisco Piscitelli, and Domenico Vito. The paper was accepted on the Environmental Research Journal, and it is the abstract of the study. You can see a brief presentation of in the abstract of the study that I performed. Thanks also to the university of my affiliation, that it is University of Sannio, and also to University of Milan and the Complutense University of Madrid. Basically, the first things that I performed was the dataset of the HEBS. It is an open dataset that is available for all the people, all the researchers in the European Union, and take the selection of the household in Italy and in Italy and in Spain. Basically, what the HEBS is the bigger survey on the expenditures of the people around the Europe. And so we have all the estimation of all the expenditures of the Europeans divided for the country. The Spanish dataset, that was the dataset when I perform the statistical model, contains 3,000 households, and this one was recording for the 2 years of the pandemics. So retrospectively selected only the 2 years that I needed for the exposure time for my correlation. And we have to stay, and after I perform the model to correct all the patterns for the family size and the family type and the economic situation, to have more homogeneity inside of the sample. First, talking about the model. It is a statistical model that is modeling the ILA model, the Bayesian Spatial Time model. It is a distributed model in the outcome with n Poisson, and the parameters of the Poisson is decomposed in 2 parts. Obviously, one expresses the relative risk of the area in question that I analyzed, and the other representing the number of cases expected in the area. So what I did before is plotting all the household on the maps, and with a Poisson modeling these 2 parameters, the relative risk and the case expected in each area. After, with a matrix of special correlation, I define the influenced area between them. So ILA take me the opportunity, this new method, Bayesian method, take me the opportunity to build all the point of the matrix, also where the sample was not recording, and have an estimation for all the area in Spain and Italy. The modeling that I observe was that I estimate and observe was a spatial autocorrelation model, in which one is very close to the GLM, but with an effect, and this effect gives us the parameters of estimation. The difference between this autocorrelation model and the parameter and the GLM is that instead of the error, we have a spatial E factor. The process just need after to updated by adding the temporal components because before we controlling the spatial parts, and after adding the in the matrix the spatial components, we have the distribution with the two units, the spatial component and the time component. After that, I did this adjustment and this plotting and this distribution, I adopt ILA. ILA give me the possibility, as I said before, with the Monte Carlo simulation, to have all the estimation for all the populations in all pattern on the population. So ILA is a good method to do this type of analysis. Because it's a suitable method for this type of model, and also because use the Gaussian Markov random files, the latent Gaussian model, and the Laplace approximation. These three approximations give us the possibility to do inference in the spatial data. One of the most difficult part of the dataset, we come back now in the dataset, was the control of the coefficient of correction HBS. So what are these components? Each household has a single correction, and this correction is given from the National Institute of Statistics of the country, ISTAT and ILA, and INE in Spain. And this coefficient of correction is given from a correction from municipality for take a reason for the expenditures of the income and expenditures of each cluster, and also the foreign resident in the country. All these three parameters build the coefficient correction of Eurostat in the HEBS. So another problem was to correct this coefficient of correction. After to correct the coefficient of correction, we start with the simulation. The simulation in the first part, we did the original distribution. So this distribution was the crude distribution, so only the sample distribution. After, with the two methods, the first one is to generalize this distribution to a Poisson, and after apply an ILA, we obtain this model. The model was performed with the Poisson, but also with the binomial negative and a zip, but to give a difference between the three models. We can see that the Poisson is more the more balanced model in probability, because have the higher estimation, 8,245. So the sample, as I said before, after we performed in the part of the practical, so for the correlation between the COVID and the green area, we select two cohorts. The first cohort was given by Spanish Institute of Public Health and the cohort of the COVID, and the Italian and the other one, the Italian Civil Protection Department. The first cohort was the cohort of the COVID. After we take the second cohort, the cohort of the green area, and the second cohort was given by INE and ISTAT with the estimation that I talked before in the sample. After we corrected the factor, we had also a correction factor, and the correction factor was the external register of the green area that is given by the OECD in the survey of 2014 for the public area. So the sample, the consistency, the first part of the study, I studied the consistency of the sample. So we can see that in Italy, the sample was composed by 3,043 units. The mean of the green area in the dataset of the ISTAT was 209.65 meters square for 100,000 people, inhabitants. Obviously, these values are taken only for the public area. So because in the first selection we did in the second cohort we selected only the province with more 500,000 inhabitants. So in the second part, we divided the green areas in Italy in three different patterns: low, medium, and high. So here in the table 2, we have the distribution of the three patterns. And after I apply in the year 2020 this description in Mian for the contagious, the hospital admission, and the deaths cases. So here we have the two cohorts and the factor, the correction factor for the year 2020. Obviously, the correction factor was fixed in the year 2014. It is the situation in Italy, the sample situation in 2021. In 2021, we had 4,015 units. In the first, in the table 3, we have the division of in three patterns about the green area, as before. And in the second part, we have the description of the contagious, hospital admission, and the deaths. It is the situation in Spain on 2020 in the same methodology of Italy. We have 3,068 units. So in the table 7, we have the correction factor, that this correction, external factor or correction factor is the green area in Spain for the data, external data of OECD in 2014. It is fixed, and it is the units in meter square for the public green area in Spain for 10,000 inhabitants. In the table 6 and table 8, we have the distribution of the cohort. In the table 6, the second cohort, and in table 8, the first cohort. As you can see, the data are more or less consistency with Italy, but the first things that you have to remember until the final, that the incidence of the green area are very different and slow comparing with the Italian. Here we have the situation in the sample of 2021 in Spain, and it was composed by 3,068 units, the same of the before, because the INE, the National Institute of Spain, use the same units and following the time in the survey. And now we can see the first results. As I said to you before, we have to remember that there are a consistency difference between Italy and Spain in terms of incidence for the public green area. Obviously, this difference was proved by a Wilcoxon test, because firstly, we tested the two different, the normal probability of the two different countries, and we said that it's not respected the Kolmogorov test. After so, we take the decision to test these two areas by a Wilcoxon test, no parametric test, the Wilcoxon test. The p-value for this test was significant, and we can say that the difference between Italy and Spain is more or less 124.85 incidence meter square for the public health, more in Italy than in Spain. It means that the analysis that I expected was more evident for Italy than in Spain. It is the first results in Spain. We can see that the results in Spain is coherent with the ones that I expected. All the model that I produced in linear multivariable regression was model that I produced with a correction, the correction of population. Why I corrected for the population? To give the same weight for all the geographic pattern, and give the same probability to be exposed to the green area. You can see that the correction is efficacy. It is stable to the value 0, but the most important results was the green area and the air pollution. And in the first case, in the case when we have like a dependent variable of contagious, we have a diminution of contagious in the green area, and this diminution is significant. Also, we can have a higher air pollution, but in the first scheme that you can see in 2020, it is not significant. So we can say that in the first phases of the COVID-19, we had a good correlation between the green area, the contagious, the hospitalization, and the deaths. And this trend is respected in a diminution of contagious, a diminution of hospitalized, and diminution of the deaths when we have an increase of the public green area. In the second model, we have the results of 2021. The results is more clear because we are in advanced phases of the COVID-19. We can see that in terms of contagious, we have less contagious in the green area, but higher contagious in the air pollution. In this multivariate model, we can say that green area and air pollution are two factors for the COVID contagious. The same we can say for the hospitalized, but the results that is more evident is the deaths. You can see that we have an increase of 243 cases for 1,000 inhabitants for the air pollution deaths due for COVID, and a less of 34.99 deaths for 100,000 inhabitants in the green area, public green area pattern. All the models are very good. The best one is with the contagious in the 2021 because the adjusted R squared is very high. After I would test in terms of relative risk and odds ratio. Take like a dependent variable in the logistic multivariable models, the three patterns of low, medium, and high. Take with as low like a reference in the analysis. And also I take a third analysis, median versus high. If we say this model, we can see that the medium, the low, the spread between low to medium in terms of green area is a factor product. You can see the first one in 2022 in terms of contagious, it was a product factor because the odds ratio is less than 1, 0.22. The same we can say if we consider the odds ratio between low and high. It is a protection factor of 0.27. And if we consider median versus high, we can see that it is a risk factor of 1.25. The p-value is significant, 0.04. And also for the hospitalized and also for the deaths, respect the same trend. It is in the 2020 without the adjustment and with the adjustment. You can see with the adjustment for PM 2.5, the situation is better. And we have more clear protective and risk factor. The same I did for 2021. We can say that the situation is a bit different. The situation here is that a situation of confused, but it could be because also we have less less geographical parts with the public area. But okay, the trend is respected as well. The IC is high, and so the trend is respected in both the model in 2020 and 2021, with the adjustment and without the adjustment, isolating the adjustment. But with the adjustment, the results are more evident. Also, the same process for Italy. We can see that for Italy, the situation is more clear. The situation is more clear because if you remember the exploratory analysis that I did in the first part, you remember that in Italy we have a more public area comparing green area comparing with Spain, and it is respected also in the results. You can see that in 2021, in a phase of advanced COVID, the results are more clear. And the only things that change are the hospitalized. But obviously, in the first part of the COVID, the hospitalization was more confused than in second part. But the deaths are more clear and more high. We have in the last model, when we consider in the 2021 the deaths like a dependent variable, we have less deaths in the public green area and also more in air pollution, but this value is very dramatic. It's like 796 more cases for 100,000 inhabitants. And for the air pollution and for green area is minus 115 for 100,000 inhabitants. After reproducing the logistic multivariable models, also for this analysis, you can see that the results are more protective and more risky in same cases. The median versus high is now not a protective a risk factor, but a protective factor. It means that in Spain, we have a more desertic country because we have more difference between low, median, and high. In Italy, we have more public area and more green area. And obviously, Italy is the second country with more public green area in Europe. And you can see that the trend is the same and is more highlighting with the low and median area, green area, like a protective values, with and without adjustment of PM2.5. If we adjusted for PM2.5, obviously, we have a more correct value because we have a correlation between the green area and air pollution. In the conclusion, we can see that the green public area are a protective factor for the COVID-19. So the adjusted additional effect of air pollution was shown to a similar results or better results. And it is in line with the resolution adopted at COP26. The protective public health measures in the view of the pandemic, it could be a good results in reduction of air pollution and reforestation. This study was a great success. A lot of media and not only the scientific academy talking about it. In Italy, for example, we had the article for La Repubblica, Corriere della Sera, La Stampa, Rai News, and also an interview in Radio Radicale. In Spain, we had an article in AS and in Onda Cero and in Forbes in Mexico. And also we had the Journal of Portugal, Pagina 12 and Rejao Sul. Thanks for the attention. And if you have a question, I am home to answer you. Someone for a question? Someone for question? I think no question.
No question from me, Andrea.
Okay. I think that you can start. Okay.
Oh, I think
Domenico.
It's not just a question, but just an add to the presentation of Andrea. Actually, I participated to the study, and actually this study demonstrates really the strong connection between like the ecosystem preservation and human health, that's standing in the concept of One Health. This study has helped properly to understand this point, that is very important to orient also the urban policies and urban development on the next few years.
Thanks, Domenico. So I think, Annal, you can start with your presentation.
Yeah, perfect. Okay, can you see that okay?
Yes, I can see.
Cool. Thanks, Andrea, for this very interesting presentation. And I think this kind of follows on actually a little bit from what you were discussing, particularly surrounding the air pollution. So we conducted a systematic review looking at the impact of COVID-19 restrictions on air pollution concentration in low and middle income countries, and specifically looking at traffic-related air pollution, which is associated with quite significant morbidity and mortality, specifically cardiovascular, metabolic diseases, as well as malignancies. And there's projected to be a large amount of urban growth in low and middle income countries, and means there'll be a disproportionate exposure to air pollution, particularly as a lot of policies within cities in these settings are devised based on cost-benefit analyses, as well as monetary incentives to promote motorization, and therefore increasing exposure to the local population, and doesn't account for how these policies will affect air pollution and therefore the health of the local population. Whereas the COVID-19 pandemic provided a very unique opportunity where we can quantify changes in air pollution, and then further down the line, potentially find out, better understand the impact low air pollution can have. So in our systematic review, we aim to quantify the percentage change in the concentration of TRAP-specific markers, TRAP standing for traffic-related air pollutants. So specifically black carbon, oxides of nitrogen, nitric oxide, nitrogen dioxide, and ultrafine particles. And we aim to quantify the mean difference of these pollutants in relation to the level of restrictions. So we conducted our searches across 5 databases, looking at publications from January 2019 to March 2022, and looking at studies that provided city-level air pollution concentrations or changes in air pollutions before and after lockdown implementation. And to ensure that we had a standardized quantitative scale for levels of restriction, we used the Oxford COVID-19 Government Response Tracker, which basically is a scale of 0 to 100 on level of restrictions, with 100 being the most restrictive. And our initial returns from the searches show 2,982 publications, which we screen in duplicates, both title abstracts and in full text, and arrived at 222 studies with extractable data. And of those 222, about 85% of publications were actually from Asia, 40% from India, 30% from China, and after that was Brazil with only 5%. And there were no publications from sub-Saharan Africa. You can also see when we mapped out the stringency index on the Oxford Government Response Tracker, the level of restrictions varied by what time they were implemented in the different countries and the level of restrictions. As you can see in Taiwan, it's very faint, well, it's very light blue, which means that the restrictions were quite relaxed in comparison to other countries. So from our 222 studies, we had 1,073 data points, and none of those data points were for ultrafine particles, unfortunately, so that hasn't been included in any of the analysis. But we can see that there is quite a significant, quite a big percentage change in mean concentrations of all 4 air pollutants. And when we use the data to construct a meta-analysis with a random effects model, we can see that reduction is statistically significant across all 4 pollutants. You can probably see from the nitric oxide, nitrogen dioxide, and oxides in nitrogen, the heterogeneity is quite high, and this probably requires some further investigation. But we can see that the prediction interval for oxides of nitrogen and nitrogen dioxide are still below 0, showing that these effects are true for all the study settings included in the meta-analysis. Now, nitrogen dioxide, we had 197 data points, and that covered 17 countries. And the countries highlighted in bold are the ones that showed a statistically significant reduction. The ones that haven't had quite wide confidence intervals, and likely we didn't see this change because of low precision level, and that could be because of the number of studies in our analysis, but also it could be that studies were underpowered, and we didn't really look into that during the data extraction and the preliminary analysis phase. We did conduct a meta-regression looking at how using stringency index as an explanatory variable. And we can see for black carbon, nitrogen dioxide, and for NOx, levels of restriction did have a moderating effect. However, you can see firstly that the heterogeneity is quite high. The residual variance isn't really explained for any of the nitrogen-based air pollutants, and the coefficient is actually positive, which goes against the meta-analysis findings. And this is likely due to the stringency index having small intervals, because we only took concentrations at the highest level of restrictions. But also we didn't account for quite a large number of confounders. A lot of the data came from India and China, which are large land masses and will have interregional variation, both so including industrial activity, population density, and meteorological factors such as wind speed and rainfall. So the implications of our finding is, well, we've conducted the largest systematic review on trap-specific markers in low and middle-income countries to date. And we've quantified that there were reductions in trap-specific markers, and highlights that policies can lead to immediate reductions in air pollution. We also identified there are quite significant gaps in the geographical distribution of available air pollutant data. There are no publications from sub-Saharan Africa. Now, by 2050, it's predicted about 26 African countries will probably double in their population, predominantly in urban areas. So it is a big issue that there's a lack of data in these countries. The positive coefficient we saw in the meta-regression highlights that there were limitations. As I already mentioned, there was evidence of reporting bias, as most of the data came from India and China. And although I haven't shown it in the slides, there was significant small study effect for black carbon, nitrogen dioxide, and NOx indicates a publication bias, although this could be related to high heterogeneity for the nitrogen-based air pollutants. We also didn't account for the influence of meteorological factors, which does have a significant influence on dispersion of air pollutants. And our explanatory variable of level of restriction is limited because, well, it's based on policy, not on whether people actually adhere to the policy or not. So future work is that we'd like to broaden the geography of the study of the countries we've included, and this probably requires some invitations and levels of precision. We'd also like to include the meteorological data and other air pollutants, which is what we're planning to do as the next steps, to see what kind of correlations we're seeing, whether the changes are related to changes in motor vehicle activity or changes in industrial activity in a lot of these cities. And finally, I think it's very important with air pollution data that we translate this information into easily to translate it into very clear public health outcomes. So with this data, we'll plan to carry out health impact assessments in certain cities of low and middle income countries. I'd like to thank the Public Health Modelling Group, the MRC Epidemiology of University of Cambridge, in particular my supervisor, Dr. Nahin. And thank you for listening. And if there's any questions, please let me know now or later. My email address is available above. I take it from the silence I've either preempted all your questions before the presentation, or I've shocked you with the results. But my email address is there, so if you do have any questions, please feel free to email me. Well, thank you very much. Andrea, I think we're the only presenters for this session.
I don't know if we have another person that have to present. I think that we are the only two, but I don't know, because there is Domenico is my partner.
The only two.
Domenico is my partner. Zahid, I don't know who is. I don't know.
Okay. Yeah, unfortunately, my team, or the team I'm with, presenting in other sessions, so they couldn't join.
I don't know really.
Yeah.
But it's very interesting, your paper. I think I have to read better as well, because in the presentation is very difficult to understand everything, but the results are very good. Congrats.
Yeah, no, a lot of the maths, so I'm a medic by background, so a lot of the maths presenting I need to get my head around, so particularly with the more kind of advanced modelling you've been doing. Be interesting to know, is particularly with you were saying about COVID-19 hospitalizations. I do better understand the methods behind that.
We have Zahid. Zahid, you...
Yes, right. Yeah. I was a little bit confused about this timing and this presentation, but I think what I can share my screen, what I was supposed to talk about.
Sure.
Can you see my screen?
Yes, I can see.
Yes.
All right. Okay, so I'll take you to the slideshow mode. This is discussing about the availability of green space and changes over the years, and assessment based on spatial analysis to identify the impact on urban health. This is with respect to, we know that it's a particular city, but we know that green space is crucial. We know the opportunity to spend time in green space has health benefits, and of course we know it also helps to refine the air quality, and particularly in that sense it will protect the urban region. So Dhaka, we'll talk about mostly in Dhaka city's context. It's a mega city of the huge population, and where the migrants population coming from the rural areas, and that is really reducing the availability of the green space. So what we tried to do in this study, which is a study conducted under the Wellcome Trust funded Pathways to Equitable Healthy City, particularly working on using more secondary data and really to assess the availability and accessibility of green space in Dhaka city, and to detect the change in the vegetation over the years, and to determine the impact of vegetation on the temperature and humidity. So basically in the availability of green space, it's mostly depending upon the calculation done in the GIS environment, and also to detect the changes over the vegetation. We have used a remote sensing technique and NDVI calculation for the year from 1990 to 2020. Then to determine the impact of vegetation on temperature and humidity, we kind of calculated the LSD and NDMI for the temperature and humidity respectively. Then determining the correlation between NDVI, LSTI and NDVI for all the years. This is a map of the Dhaka city, and rightly on the left hand side, you can see the it's a green space, and then these are small areas of Dhaka city, the ward boundary, which is like, normally we use this as a kind of a sampling area, but actually the whole city is in administrative units, are these are small ward boundaries. And these are the areas which is the old part of Dhaka. And then later on, these are the areas where the Dhaka is growing for the extending the green space. So the per capita green space, we try to kind of estimate that, okay, given the population for each of these wards and how is the distribution of the green space looks like. So and then we try to kind of really find out that, okay, so green space is there, and say, well, the buffer said, well, this is a green space and there should not be anything around that space. So it would be the, like, 100-meter buffer, 300-meter buffer. And where are the roads and residential areas? We try to kind of look at that. And then areas coverage in residential areas. So the area covered by, if you say they take the buffer areas and see that, well, these are probably mostly kind of gets the benefit of the green space, and given the residential area concentrated and distribution. So what really actually happened over the period of 1990 to 2000, and see that how we have, the city in 30 years, the NDVI gives us an idea that how that changed. And as we mentioned, that is a relationship in LSD values and how it has high and low values over the period. So what we really wanted to kind of see that what is a change in the vegetation of the period, and see that how it has gone in the 30 years that it has changed over time period. What is really, which is like, 2.2%, 24% coverage of the green space. So only 3 wards out of 110 wards, but we are saying Dhaka city have greater than 20% of average. Not too many. Actually, they should have more. I mean, let's say 20% of the coverage. So only 0.0032 square meters per capita green space was the highest. So a total of 56.5 square kilometers areas of 77 square kilometers in residential area fell under these buffer zones. And so, but again, we know that over the time, Dhaka city, the increased temperature and decrease in humidity was observed. And we see that what really happened with respect to the other climate factors or variable factors. So in all 54 wards that are small and administrative unit, vegetation and humidity decreased, whereas temperature has increased over time. So this is basically the idea, trying to kind of say what has happened over the time, and the city has growing and over time, and we see that what is happening to the buffer zone. But of course, that the coverage of the green space is getting smaller day by day, and like not too many wards and distribution, which is in this country, in the city, is really is a threat. So this is basically, and the future work we are now working is that, okay, we introduce more modeling work and what we will really see the picture over time and changes that may happen, and which is really becoming a threat. And of course, we keeping that in our mind, we have seen that the population pressure and the migration because of the economic benefits of living in this and the income generating activities in the city, which has made it worse and explode that expanding the areas of housing and losing our green space. So this is really, we have kind of an oral experience when we try to discuss with this kind of in this project and bringing the people together, and then we're saying that there should be a kind of a comprehensive, more concerted effort of all different agencies within the city, and all these policymakers are saying that kind of bringing a policy scenario, and then we are working towards that point, that how this combination of different policy scenario can help in improving the green space. So that are the type of work, and more working much more on the modeling type and extending this model work to see and get our results more soon. So that is the next stage of the work. But I will stop here if there is any questions that if you have. You can also send me questions and requests through email, and that can be also possible. So I'll stop here and take questions and listen to you if you have any suggestion to improve our work. Thank you.
Thanks, Nahin. I don't have any questions on my end.
I have no question from my side. Thank you. If I have some question that I remember something, I text you. Thanks.
Thank you. Thank you very much. Thank you.